My name is Annie and I give consent.
My first priority assessment will be a respiratory inspection of the chest. I am looking at the shape and symmetry of the chest from the front and the back, the costal angle, the angle of the ribs, and the intercostal spaces. I am also assessing for any increase in AP diameter. I'm now going to count the number of respirations per minute and observe the pattern of respirations and the way in which the chest moves. I'm also going to look at the lips and the nail beds for cyanosis, the lips for any pursing, and any signs of nasal flaring. Next, I am going to do a respiratory palpation assessment. I am placing my hands on the back with my thumbs along the spinal process at the level of the 10th rib and palpating thoracic expansion. I am identifying any areas of tenderness or deformity the patient has and assessing expansion and symmetry. Next, I am going to evaluate for tactile phragmitis. I'm going to ask the patient to recite the words 99 a few times while I palpate posteriorly and laterally at the level of the bifurcation of the bronchi, using the palmar surface of my hands.
99, 99, 99, 99.
I am assessing for symmetry of vibration on each side. Now I am going to palpate to evaluate the midline position of the trachea. I'm placing my index fingers in the suprasternal notch and moving it from side to side along the upper edges of the clavicle and the spaces around the inner borders of the sternocleidomastoid muscles. I am going to palpate the trachea with both thumbs simultaneously. Auscultation will be my third priority assessment for this patient, and I'm going to have her sit up straight and breathe slowly and deeply with an open mouth. I'm going to have you lean forward a little bit, and I'll start by listening posterior, starting at the apices and moving from side to side to the bases, looking for symmetry, looking and listening for symmetry. I will listen in 10 places posteriorly, and I will start by identifying the spinous process at C7 and count thoracic vertebrae from here, starting at T1 to identify the apices. Now I'm going to have you raise your hands up above your head, and I'm going to listen to your right and left lateral chest, starting at the mid-clavicular line, and I'm going to listen to 4 places on each side. Lastly, I'm going to have you face me, and I'm going to listen to you in an additional 8 places, starting at the apices, which is 4 centimeters above the first rib. And I am noting the length of inspiration to expiration as well. So next to assess for vocal resonance, I'm going to assess for bronchophony. I'm going to have you say the words 99 a couple times while I listen.
99, 99, 99, 99.
Continuing on with the voice transmission test, I'm going to assess for whispered pectoriloquy by having you whisper the numbers 1, 2, 3 several times while I listen. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. And so lastly, to assess for egophony, I'm going to have you say the letter E continuously while I listen. This concludes my 3 priority assessments for this case study, and I would like to thank my patient. And thank you for watching.